to our 2016 Washington Days webinar. With us today we have members of our federal consultant, Joanna Gray, Beth Marshall from our communications department, and Dennis, who's consulting with us on a special initiative we're launching this year. So I'm going to turn it over now. If you have questions, please submit questions into the question box and or the chat. We will answer questions at the end. And I'll get muted. Go ahead. Joanna.
Great. Thanks so much, Marla. And I'm so pleased to welcome everyone to the webinar. My name is Joanna Gray, and I am one of NHF's federal policy advisors responsible for planning Washington Days. And I'm so glad you've joined us today to learn a little more about what we'll be doing at the end of the month when you guys all come to town. The webinars are new. We thought people would appreciate hearing in advance what the issues are going to be. We're also going to talk some about logistics. And as Marla said, announce a really exciting new initiative that NHF is working on that will be part of Washington Days this year, and also it's much broader than that. You can see on the slide here what we'll cover today. I just want to say at the outset that this will be a teaser to the issues that we'll be discussing, but don't worry, there will be a lot more information posted on the website and shared with you when you come to DC. So don't feel like, you know, as we go through things don't feel nervous that if you have questions to be answered or worried you don't have the whole story, because we'll make sure you're ready before we do visits. Next slide, please. These are the participants, as Marla mentioned. I'm Joanna, and then Beth Marshall with NHF, the Manager of Production and Creative Services, and Dennis DaCosta, a communications consultant, will join me in a few minutes. So first, we'll talk about what to expect and how to maximize your Washington Days experience. The next slide has the schedule of what happens over the course of the days. And I thought it might be useful to talk through these a little bit, particularly for folks who haven't attended Washington Days before. So you may wonder, you know, just what you've gotten yourself into. We start mid-afternoon on Wednesday, February 24th. Registration starts at 2, and then there are 2 important training sessions that everyone who's going to be up on the Hill the next day should plan to participate in. The first one is will specifically be about the Red Tie Challenge, which you'll hear more about in a few moments, as well as social media training, because social media has become an increasingly important part of our advocacy efforts. Beth will explain in more detail in a bit, but this is the first time that we're doing a dedicated social media training. We've heard from folks that it's something that kind of know they should do or want to be able to do, but they're not quite sure exactly how to do it. So we're going to provide some extra training there. And then at 5 o'clock, we have our traditional Washington Days training, where we will give you a sense of the context of what's happening in Washington and walk in detail through the issues, answer questions about your schedules of meetings. You know, the idea is that as of 6:30 on Wednesday that you will be good to go, you'll understand the issues and be ready to advocate the next day. There's a dinner reception after that where we encourage folks to sit in their teams so that you can start to practice telling your story, figure out how you want to divide and conquer on the issues. You know, my colleague Alan Riker and I, who are the federal policy folks, we always walk around and make sure that everyone's questions have been answered so that everyone feels comfortable. Thursday, the day that we're up on the Hill, is a long day, but I think you'll find it as exhausting as it is, it's also really exciting and rewarding. After breakfast at the hotel, we will head to Capitol Hill. We'll have some buses for folks, and we're also going to encourage folks to Metro this year because our hotel, we're in a different hotel than we've been in the past, and it's in downtown DC, and Metro will be really easy for folks. And the idea is for everyone to be up to Capitol Hill by 9 a.m. because we will have a last Washington Days briefing where we do a final run-through of the issues, and we've also invited some special guests to come and join us. So stay tuned for that. We'll have some congressional speakers, assuming all the scheduling stuff works out. And then starting at 10, you're off on your own in teams. We schedule the visits throughout the day, and that you'll get a schedule when you check in with registration on Wednesday, letting you know where to go. After that is the post-appointment check-in back at the hotel, which is really important for us to hear from you about how your day went, what questions people had, what are opportunities for follow-up. And then starting at 6 on Thursday and then going through Friday, we turn to state advocacy. There's a state advocacy dinner Thursday night, and then breakfast and a state advocacy training on Friday morning, which you'll hear a little more about as well. So with that, I'm happy to turn it over to Beth, who can tell you a little more about what to expect when you come to town and give some tips. Beth?
Hi, I'm Beth Marshall. I'm the Manager of Production and Creative Services for NHF. And one of the things that I wanted to talk to you about is just, especially for any new attendees who are coming to Washington Days, I know sometimes the whole thing can feel a little bit intimidating. You're going to be sometimes discussing issues that maybe you're not all that familiar with, but I want to make sure that everybody here understands just how much training and support that you'll have throughout the day to make sure that you're prepared on the Hill and that you're comfortable. You're never going to be alone. You're never going to have to talk to a legislator or a legislative aide by yourself. You're going to be in a group. You're going to be given plenty of time to get to know your group. If you're from a state that maybe you're the only representative from that state, you're either going to be with a neighboring state or you're going to be with members of our public policy team. So you're never going to have to go anywhere by yourself. We're going to, Joanna did allude that we're going to be giving you talking points. We're going to give you lots of time to sit together and practice to go over those talking points. So by the time, that's all on the Wednesday training, so by the time Thursday comes around, you're going to feel comfortable and confident. So one of the things that's very important when you go to these meetings is telling your story. These people, you are their constituents, and they really want to hear from you. So it's a good idea to maybe bring, if you're talking about your son or daughter with a bleeding disorder and they're not coming with you to the meeting, bring some photos. You could bring empty bottles of Factor if something to sort of connect and make it see how personal this is to you. I would also really encourage people to plan and practice a little bit, practice out loud. A lot of times people do think that they know exactly what it is that they want to say, and then they can get a little tongue-tied. So actually saying it, knowing your opening sentence and practicing that opening sentence can help. Quite often, you will not be meeting with the actual legislator. You'll be meeting with a legislative aide, a staff member. These staff members are very important people. They are quite often the brains and the organization behind the person in office. So they're often incredibly knowledgeable about healthcare, and they can really be your allies. Make sure to collect their business cards, make a connection with them, and you can speak, you should speak to them just as you would to your elected representative. And just another thing to remember, there's going to be a lot of us on the Hill that day, and you're really not just representing yourself. You are representing the whole bleeding disorders community. So please do dress to make a good impression. Washington, D.C. is the dress style is business. They wear suits, they wear skirts, they wear ties. You don't have to wear a suit, but it is good if you are wearing clean, ironed, business casual clothes. A button-down shirt and a tie and dress pants for men is appropriate. For women, something nice and business casual is also appropriate. The other thing to really keep in mind, because These corridors are long and they are marble, and the buildings are quite far apart. So please do not wear high heels. Wear comfortable shoes. You will be walking quite often. The distance between the Senate and the House buildings is kind of across this plaza. Do low-heeled shoes. Get some of those little gel inserts. Make sure your shoes are broken in. I don't mean to make light of it, but I've gone up on the Hill visits for about 8 years now, and I speak from experience. So the other thing that I want to talk to you a little bit is our social media engagement. We have a big social media presence at Washington Days. We always use our Washington Days hashtag on Twitter and Instagram, which is always NHFWD. All of our, nearly all, I would say about 99.9% of the elected representatives use social media. They use Twitter, they use Facebook. A lot of them now, especially like you'll see Senator Booker from New Jersey, who's kind of a power social media user, uses Instagram and Snapchat. So it's a great way to connect with your constituent, with your elected representatives. You see we have the, they will see it, they will retweet it if you engage them on social media. So I will be doing a social media training. In fact, I'll be doing two. I'll be doing a very in-depth social media one-on-one training Wednesday afternoon, and then I'll be doing a more sort of overview training during the Washington Days training Wednesday night. But if you don't feel that comfortable using social media channels, I strongly encourage you to come to these trainings. We're going to help you if you're not comfortable, we're going to help you get set up. I can help you set up a Twitter account. I can help you set up an Instagram account. We'll have the Twitter handles and Instagram accounts of all your elected representatives, so you don't need to try to find them. And we'll basically support you in that as much as you can. And another thing to keep in mind, and why we really encourage people to get on their social media channels for Washington Days, is there will be about 300 of us on the Hill. And that'll feel like a lot when we're all sitting in that ballroom ready to go out. But when you actually get to the Hill, you'll see a lot of other groups, and you'll see really just how many people are walking those halls of Congress trying to get things done. So we're a small group, and we need to be able to raise our voice. And social media is a really effective way for us to speak more loudly than we would have been able to. So with that, I'm going to turn it back over to Joanna to speak about the issues.
Great. Thanks so much, Beth. The next slide has an overview of the 3 issues that we will be advocating for at Washington Days this year. Folks who've come before will recognize the first one, because advocating for federal funding for the bleeding disorders programs at CDC and HRSA is something we talk about every year and have for many years. And I'll explain that a little more in a sec. And then we have 2 new issues, which I'm really excited about. One is about ensuring access to patient assistance programs for people on plans offered on the new ACA marketplaces. And the other is what we keep teasing, the NHF's Red Tie Challenge, and how we want members of Congress to show their support for raising awareness about bleeding disorders and their support for our community. So the next slide has a little more detail about our federal funding concerns. And for folks who've come before, you may be wondering why we talk about this every year, because the budget process is so arcane, and it's hard to understand, and it's hard to explain, and you know, you read about the government being shut down periodically, and you know, where do our programs, our bleeding disorder specific programs fit in everything. And I would say that there's a cliche in Washington which says that if you are not at the table, you are on the menu, which is a very cute turn of phrase, and I also think is absolutely true when it comes to appropriations or funding decisions made by Congress. They need to hear from us that these programs are important to our community, because if they don't, they'll think we don't care, and then the programs don't have value, and then I guarantee you that they will reallocate these funds to other programs for folks that they're hearing from. So it's really important that we talk about the programs, and I think it also gives us a way to talk about HTCs, because as you'll see here on the slide, the two programs provide funding to HTCs. It's a way to talk about HTCs and access to HTCs, which I think is an important part of kind of telling the story of the bleeding disorders community. So the first program is at HRSA, and this program provides $4.9 million to HTCs to cover multidisciplinary kind of care coordination services that are not typically reimbursed by insurance. So this is case management and the social worker services, the PT assessment, the kind of comprehensive services that you may get when you go for your annual visit. A lot of those services are not covered by insurance, and so the funding at HRSA goes to support those. The CDC programs are about surveillance and prevention. HTCs get another $5 million to support surveillance. If you're participating in the Community Counts project at your HTC, that is the CDC surveillance project now. Folks who've been around a long time will remember UDC, which was the surveillance project before Community Counts. And the second piece of the CDC program is to support patient education and outreach activities at organizations like NHF and HFA, who both have cooperative agreements with CDC to support programs like Handy and Steps for Living, things like that. And there's also important work being done at the CDC, at its lab. Lately, they've really been focusing on inhibitors, and their research has led to the development of a new testing method for inhibitors, and they've made some recommendations about inhibitor screening, which has led to NHF's MASAC making a recommendation last year that all people with hemophilia should be screened for inhibitors every year. Both CDC and HRSA activities are about kind of bolstering the national network of HTCs, and I think the CDC's focus on inhibitors recently has really shows how much I think they understand our community and why they're addressing things that people are really concerned about. The next slide has the ask, that exactly what we want members of Congress to do, and that's to support full funding of these programs at HRSA and CDC. When you get to town, we'll give some more details about if your members are on the Appropriations Committee, which directly decides what funding levels will be, kind of what we want those folks to do versus other members. So we'll give you more details, but basically we need as many members as possible to support funding for these programs so we can be sure that they continue and that the support for HTCs and the important programs can continue. Okay, so changing gears, our next issue is a new one this year, and this is about ensuring access to third-party premium assistance programs. So as everyone on the call knows, there are many folks in our community who rely on third-party nonprofit patient assistance programs to be able to afford their health insurance premiums. So these are the kinds of services that PSI provides, but there are a number of other nonprofit organizations that do similar work. And the problem is that for people who are enrolled in the plans offered on the health insurance marketplaces, those plans have discretion about whether they have to accept premium assistance from these nonprofits. So CMS, which is the federal agency implementing the Affordable Care Act, came out with a rule, I guess, now it's almost 2 years ago, that said that plans have to accept premium assistance from public programs, so like the Ryan White program or say a state hemophilia program. I know there are some of those that help pay for premiums. The plans have to accept those payments, but they do not, they can decide whether or not they want to accept the nonprofit ones. And unfortunately, it's 37 states where there's at least one plan that's refused premium assistance from a group like PSI. Now, I want to be clear that it's not every plan in 37 states, and it's not, and this is really premium assistance we're talking about here, not copay assistance. But this is alarming, right, that there are so many states where folks who rely on groups to be able to afford their health insurance, their plans now saying they're not allowed to do that. You may be wondering why an insurance plan would care whether the check for my premium comes from me, Joanna, or comes from PSI on my behalf. And I think it's a way for them to avoid having people who kind of have expensive chronic conditions, the kind of people who even know that patient assistance programs exist. It's a way for them to say, to avoid having those people pick their plans. Because if I'm choosing a plan in DC, for example, and I know one will accept PSI's checks and the other won't, and I need PSI to help, I'm going to pick the, the second plan and not the first, which means the first can avoid having me on their plan. So it's kind of a, I think it's like a tricky health insurance maneuvering situation here that unfortunately is being allowed by the government, which undermines, some of the non-discrimination and other aspects of the ACA. So the solution to the problem is on the next slide. There is a bill that's been introduced in the House of Representatives. It's H.R. 3742, the Access to Marketplace Insurance Act, which basically says that plans have to accept third-party payments from nonprofits. So where they currently can decide, they have discretion from the government, Congress would say, no, you have to accept these payments. This would help folks in our community who need nonprofit assistance, but there's, many, many other folks who have other rare and chronic and acute conditions who use patient assistance programs and who wouldn't be allowed to moving forward. This is a bipartisan bill that was introduced by Congressman Kevin Kramer from North Dakota. And we have 17 co-sponsors so far, and I'm hopeful at the end of Washington days we will have way more. In the Senate, the goal is to identify folks to introduce companion legislation. As you may remember from Schoolhouse Rock, how a bill becomes a law, you need a House bill and a Senate bill to both pass. So we need to add co-sponsors to the House bill and then get a Senate bill introduced for this to become law. Okay, so that's the summary of the first two issues. I'm happy now to turn it over to Dennis, who will, after all this teasing, explain the Red Tie Challenge.
Thank you very much, Joanna. And again, I'm Dennis DaCosta. It's great to be with you, and especially to be the one who lets you know about the Red Tie Challenge and Bleeding Disorders Awareness Month. And the tie between the two is that the purpose of the Red Tie Challenge this year was to activate the community, convince the Department of Health and Human Services to designate March Bleeding Disorders Awareness Month, but that activity was so effective, the month has already been proclaimed. So about a week ago, on the official National Health Observance site, HHS, the Department of Health and Human Services, listed Bleeding Disorders Awareness Month. So we're really happy about that, and the reaction from the community has been wonderful. So earlier we talked about the story, the power of the story when you're speaking to members of Congress or members of their staffs, and it all begins with a story. And to discuss the Red Tie Challenge, we want to take a step back and really talk about what you know, and that is that in recent years, your community, our community, has made great strides in treatment and policy and advocacy, but something seemed to be missing. A unifying activity, a movement that embraced all members inside our community and encourages all of us to stand up and be noticed and in all frankness, to take inheritable bleeding disorders out of the shadows. So in thinking of a movement, thought was given to, if we were to create one, what should it do? What are some of the elements that it should comprise? And first of all, it should forge a stronger sense of community and shared purpose among individuals with all inheritable bleeding disorders, hemophilia, von Willebrand disease, rare factor disorders, and beyond. It should also create greater understanding among all of us that we're not alone in the fight and can have hope, which is so important. But beyond our community, a goal would be to elevate awareness and engagement in the journey, and every person in the community has a journey, to elevate that awareness beyond our community. And in turn, for even more revolutionary science that will lead to better treatments and ultimately cures. And also very important is to amplify the role of NHF in fostering research and public policy and advocacy. And it's important to amplify NHF because as the advocate for the community, for the bleeding community, by making NHF stronger, the community stronger as a whole. The campaign that has been developed is the Red Tie Challenge, and this is our campaign logo. On top, you can see the recognition that March is Bleeding Disorders Awareness Month. This will be the first one in actually about 3 weeks. And the Red Tie Challenge itself is a movement that challenges individuals very simply to show us how they wear a red tie. And in so doing, to show support for March, we're giving people an activity, and we'll talk about in a second why the red tie. But we want them to do something and use that as kind of a hook or a way to attract attention to the fact. So taking a step back again, the story arc. Why a red tie? And red, of course, you already guessed. Red symbolizes the blood ties, the color red and the tie that bind our community together. Obviously, parent to child, family to family, family to caregiver, HCPs, and on and on. The color red also conveys such emotions as love and strength and leadership, courage, determination, which is what the community is all about. It's just that now we're coming out in a more public way. The whole concept of making a tie is a perennial challenge for anyone who uses it, but especially when you broaden it out to both men and women, and of course ties are a fashion statement for both, the possibilities are endless. The red tie, we hope, has the potential to become a unifying icon for the community, similar to the pink ribbon and the red dress for Women's Heart Awareness. And those are probably the two icons that are most known, and even if the red tie can achieve just a small portion of the notoriety and instant acceptance that those two have, we will be in very good shape. Finally, the red tie icon provides many possibilities, such as red tie fairs and galas during the month and beyond the month, since it's a campaign that will go on through at least the fall. 2016 is very significant additionally in terms of designating the first Bleeding Disorders Awareness Month. I believe it was in February that President Ronald Reagan designated March of 1986, 30 years ago, as Hemophilia Awareness Month. But the interesting fact you may be aware of, that designation was only for 1 month, 1 time, 1 year. And as you know, this year marks the world's largest gathering of global bleeding disorders experts in Orlando in July, when NHF will host the annual Congress, or the biannual Congress, of the World Federation of Hemophilia. So what does the Red Tie Challenge do? It's really very simple. It asks individuals to get creative, or groups, get creative in showing us how they wear a red tie. And then we ask them to record, or have someone record, their best tie look, and pledge to support March 2016 as the first Bleeding Disorders Awareness Month, and then challenge a few friends. In turn, we want them to post their videos on their social channels with the hashtag Red Tie Challenge, and use that as another opportunity to challenge their followers, and also consider making a donation to redtiechallenge.org. The Red Tie Challenge and Bleeding Disorders Awareness Month, again, recognize, as we said earlier, that our community is comprised of people with many different bleeding disorders. We set it to elevate awareness and engagement in our journey beyond the community. But above all, the bottom line is to advance the health, safety, and well-being for all people living with a bleeding disorder. Again, laddering back to the idea that we are not alone and we can have hope. There will be tools for you to use when you meet with members of Congress or their staffs. There will be a little packet, and it will contain 3 pieces. The first is a red tie to give to the staff or the member of Congress. The second will be a fact sheet, an issue fact sheet. But the third will be a graphic, what is called an infographic, and you're seeing it right here. And it's a very simple step-by-step. Actually, there's a public version that will have step-by-step on how to take the red tie challenge. But this one is specifically for Washington Days, and it captures the essence of it, and that is, what is the red tie challenge, and talking about the fact that it's a movement created by the community to start a conversation. Yes, to support the month, but the goal is to start a conversation about inheritable bleeding disorders. It describes, it answers the question, why the red tie? Because it symbolizes the blood ties that bind over 3 million Americans to our community. And then very, very important, oftentimes you see things online or on TV, or you read something, and it tells you about a really great cause or movement, but it doesn't tell you what to do. It doesn't give you an ask, and our ask is really very simple. We don't want to overwhelm people. And in a nutshell, what we're doing is asking the member of Congress to either conduct a 1-minute floor speech marking and recognizing, supporting March 2016 as the first Bleeding Disorders Month while wearing a red tie, or to post a selfie wearing a red tie to the members' social channels using the hashtag Red Tie Challenge, and then noting his or her support for March 2016 as the first Bleeding Disorders Awareness Month. So the ask that Joanna was describing is very specific as to a piece of legislation. This is a little bit more loose, and we don't want to specifically ask them to take the challenge themselves. They can do that if they wish. Very, very simple. A 1-minute floor speech supporting March 2016 as the first Bleeding Disorders Awareness Month while wearing a red tie, or posting a selfie wearing the tie, using the hashtag, and noting support for this very first month. I'd like to turn it back for some questions.
So we're getting some really great questions coming into our panelists, and if you could take a moment and submit a question, but I'm going to take the ones we've received so far. So one came in, and this one is to Joanna. Are we limited to speaking about the issues that NHF has outlined? I would like to speak to, about the particular burdens on women with bleeding disorders.
Yeah, that's I think a good and somewhat tricky question. I would encourage you to focus on these 3 issues that we have kind of identified for the community to advocate for, but I think that the first part of every meeting is introducing ourselves and sharing our stories about how we've been affected by bleeding disorders, and which is kind of the way it leads into talking about the issues, because your story is a really critical part of this and what grounds all of this kind of wonky policy stuff. So in that portion of the meeting, I would absolutely encourage you to talk about, what your situation is, and what your story has been as a woman with a bleeding disorder. I hope that you'll get to the 3 issues as well, as the really concrete things we're hoping members of Congress will do to support us. But there's absolutely room for you to tell your story as well.
Okay, and now we have like sort of a 2-part question. The first is, again for Joanna, do I need to schedule my own meetings, or does NHF do that for me? And then the second half I will address to Beth after that.
Okay, so the first half, no, you do not have to schedule your meetings. We do that for you, and in fact are already furiously doing that. We have about 300 folks have registered for Washington Days so far, and we are busy getting all the meetings set up. So you do not need to schedule your meetings. When you get to town on Wednesday, we will give you your schedule. And I would in fact really discourage folks from reaching out directly because it becomes confusing for staff who are juggling a request from you and from us. If you have a particular relationship that you think would be helpful, feel free to reach out to me and we can chat offline.
Okay, and then the second half of that is more a social media question. Prior to our meetings later this month, should we tweet at our reps that we look forward to speaking with them or their staff about funding or, HR 3742?
Yeah, that would be great. I think the more contact you have on social media in advance of the meeting is great. I would just, be sure to, make sure the interactions are, of course, as always, polite. But I don't think that there's any issue with reaching out to the staff member and trying to engage them prior to the meeting. And then, because then, you're sort of following, you can then continue the conversation directly after the meeting as well.
So the next one is for Dennis, and it's several questions about ties. So do I need to wear a red tie at Washington Days? And will the ties be provided for male attendees to wear as well as those to give out, to representatives and senators?
Hello, everybody. This is John Indents, and I'm VP of Marketing Communications with NHF, and I'll take that question. Ties are going to be supplied to everybody in attendance, as well as plenty of supply to give to your elected representatives and their staff.
All right. So the next question is for Joanna, and you kind of alluded to this a little bit before, but the next question is for Joanna. When will I know my schedule and my team, and will I be with this person asked specifically about Georgia, but will they be with someone in general from their state, and how will they know that?
Yeah, so we pair people together by state for sure. We sometimes have really big state teams where we'll divide them into, say, 2 Georgia teams or 2 New York teams, depending on how big the crowd is. In cases where you may be the only person from your state, we'll pair you with another state. Or as Beth mentioned, we'll have someone from NHF's public policy team hang out with you. You'll know your team. Which is a bonus. Don't
undersell that.
It's true. No. Ideally, you have a member of the NHF to hang with you. And anyone who specifically wants to request Marla to join their team, you can let me know that. So you will find out your team on the Saturday before Washington Days. I send emails out to everyone with their draft schedules and their teams that day. So you will know before you get to town.
Okay, the next one is for Beth. I don't own a suit. What do I do? Do I need to buy one for Washington Days?
You do not need to buy a suit to come to Washington Days. Business casual is fine. You can wear khaki or dark pants, a button-down shirt, a nice blouse for women, dress pants or a skirt, and some low-heeled, comfortable shoes, and you'll be all set.
Okay. This one's for Dennis. What are the other parts of the Red Tie Challenge besides what will happen at Washington Days?
And this is John Indents again. So there's going to be many components to this, for both from the national level and on the chapter level, and all of them will be launched, and you will all be notified during and immediately after Washington Days. But there is a very aggressive viral social media component to it.
And then this brings up the next question for Beth. I don't know how to use social media, which is quite common, at all. Will you help me set up a Twitter account, and the same, for Instagram or?
Yes. At the social media training that we're doing on Wednesday from 3 to 4, we're going to have myself, some other NHF staffers, as well as some NYLI volunteers, I think, who are going to be helping people if they're not comfortable or don't know how to set up a Twitter or Instagram account. We'll walk you through how to set it up, make sure that we have you connected, and teach you the miracles of hashtag use, and make sure that you're all set for when you go on the Hill.
Will you be similarly teaching how to not overuse the hashtag?
I will also teach I will teach proper
hashtag use.
Yeah.
And I'd like to thank everybody. We had some really great questions. These webinars will be recorded. There is another one tomorrow for our West Coast friends, which is a bit later. You can register for that one as well. Should you have any additional questions or concerns, please reach out to us and have a great day. Thank you.